We all, whether we like it or not, will die someday. Good morning. Did you have your coffee yet? Okay, try to stick around because this is important. I'm hospice nurse Julie. I have witnessed tons of people die a natural death on hospice, and because of this, I've come to TikTok to educate you about death and dying because it's important. So you may be happy to know that our body really does have a biological system built in to help us die. Here's what the natural progression usually looks like. Now, there are some differing things that may happen, and that's because of whatever disease this person is dying from. But in general, here is what it will look like. Around the 6-month mark, when they're placed on hospice, they'll be increasingly sleepy. They'll be sleeping a lot, socially withdrawing, and eating and drinking much less. Now, everybody will have a functional decline between the 6-month and the time that they die. They will slowly functionally decline, meaning they used to fully independently live, drive, walk around, go get groceries, and as time goes on, those things slowly fade away. Now they're usually in their house. Now they're usually in bed. Now they need help with bathing and eating. Now they need help with changing. This will slowly happen over time. And that is why people who are in hospice need a lot of support from either family, friends, paid caregivers, or they need to go to a facility where they can be helped by nurses. Now, dying is not painful. Dying is not painful. The disease you're dying from can be painful, but dying itself, no. During that transitional phase where you're losing functional decline, you will also likely have some mental decline, not necessarily always confused, but just sleeping a lot more, maybe some intermittent disorientation, depending on the diagnosis, of course. And of course, food and water intake. That is going to decrease. Loved ones, if you're witnessing this, it's very normal. If you are the one feeling that, it's also very normal. Please don't force yourself to take in food, water, or medications if your body doesn't want it. Almost everyone during the actively dying phase, which is a few hours to a few days before death, will be fully unconscious, not eating and drinking at all, fully bedbound and incontinent. And they will have changes in breathing, changes in skin color, sometimes noisy breath. It'll sound a little gurgly. All very normal. And the less you mess with that natural death and dying process, the more peaceful it will be. Ask me any questions in the comments. Don't forget to like and follow for more death and dying education.